Hey everyone, it's Patient Choice Month, and per your vote, we're going to talk about sciatica and what it is. So, sciatica is a little thing that happens in your low back where your nerves in your low back, they come down here and they form your sciatic nerve. Well, if you have an issue in your low back or in a place like your piriformis, that can irritate your sciatic nerve and you'll get pain all the way down your leg or front or side, whatever that is. Not a lot of people actually have true sciatica. Most people come in with some sort of low back and side issue, so we can call it sciatica. So what I want to talk about is how we first diagnose it and how do we treat it. So commonly, a patient may have pain down this line where your hips are, your low back. One other thing that we check if someone thinks they have sciatica is we'll do a straight leg raise, and if they have pain that shoots down their leg, that would be an indicator towards that being a possibility. Now, to actually diagnose sciatica, I would want somebody to get imaging, like an MRI, because if there's a disc herniation that's affecting some of the nerves, then that would be another thing to consider as well. But usually, people don't have that. So we want to make sure, come and sit up, that we're not only checking, you can fix that way, that we're not only checking how the patient's low back is moving within the low back and that side, but we want to see if muscles are firing the right way too. So 3 things that we commonly do if someone has low back pain that might be shooting down their leg is we check 3 muscles, including the rectus femoris, hold tight, which is this muscle here, let this relax, the psoas muscle, hold here, and then also the TFL, hold here. Now if we have a weakness in any of those things, that would indicate a hip issue, like in here, or a SI issue back here. And sometimes we have a combination of all 3. So if we find a lack of motion in the low back or the SI joint and muscle weaknesses on that side, usually that indicates they need some sort of adjustment in their low back or SI. So I'm going to show you a common adjustment that we deliver to patients dealing with low back pain or sciatica. So here's his lumbar spine, here's his SI joint. Usually I'm focusing on the SI joint on that side, like that. So that's a little bit about sciatica. Most patients feel good after they get adjusted. Sometimes they might need a few adjustments to get that pattern feeling better. So don't worry, low back pain and sciatica is something that we can treat all the time. You should come in and we can check you and make sure you're doing well.